What surgery looked like 1,000 years ago was not medicine as we understand it today. It was desperation, it was endurance, and it was pain. For medieval people, surgery was not a path to healing. It was a last attempt to survive. There were no hospitals as we imagine them, no sterile rooms, no anesthesia, no understanding of infection. Surgery happened wherever it had to, in homes, in monasteries, on battlefields, sometimes in the open air. The idea of cleanliness existed, but not in the way we know it. Surgeons washed their hands, but not to remove bacteria. They believed cleanliness pleased God, not that it prevented disease. Tools were simple: knives, saws, hooks, often reused, rarely cleaned properly. Blood was everywhere. There was no way to stop it. If bleeding could not be controlled, the patient died, quickly or slowly. Surgeons were not doctors. They were craftsmen, often barbers. Barber surgeons cut hair, pulled teeth, and removed limbs. They learned by watching, by practice, by failure. Formal medical training was rare. Most knowledge came from ancient texts, Greek and Roman writings, often misunderstood, often copied with errors. Human anatomy was poorly understood. Dissection was limited, sometimes forbidden. Surgeons did not know how organs truly worked. They guessed. They believed illness came from imbalance. Too much blood, too much bile, too much heat. Surgery was meant to correct imbalance, not to cure disease. Pain was expected. There was no relief, no morphine, no anesthesia. Alcohol was sometimes used, strong wine, herbal mixtures, opium if available. But mostly patients were held down by family, by assistants. Screams were normal. They echoed through homes and streets. Pain was not a side effect. It was the experience. Surviving pain was part of survival itself. Many patients fainted. Some died from shock. Others survived the operation, only to die days later. Infection was the greatest enemy, but it was invisible. Medieval people did not understand it. They saw wounds turn black. They smelled rot. They watched fevers rise. They prayed. Infection was blamed on bad air, on evil spirits, on divine punishment. Surgeons tried to help. They burned wounds. They poured wine or vinegar into cuts. They used honey. Sometimes it worked. Often it didn't. Amputation was common, especially after injuries, battle wounds, crushed limbs. If a limb became gangrenous, it had to go quickly. Speed mattered more than precision. A fast cut meant less suffering. A slow one meant death. A skilled surgeon was measured by speed, not comfort, not survival rates. Speed. Limbs were sawed off in seconds. Bones cracked. Flesh tore. Patients screamed or bit down on leather. Some were given sticks to chew. Blood loss was massive. If bleeding stopped, survival was possible. If not, death followed. Surgery was terrifying. People avoided it. They delayed treatment. They chose prayer instead. Only when death felt certain did they accept surgery. Even then, many refused. Better to die whole than live mutilated. Religious belief shaped surgery deeply. Pain was seen as meaningful, as punishment, as purification. Enduring pain was virtuous. Suffering brought people closer to God. Surgeons prayed before cutting. Patients confessed sins. Operations felt like spiritual events, not medical ones. Women faced surgery during childbirth. This was especially dangerous. Caesarean sections were almost always fatal, performed only when the mother was already dying. The goal was to save the child's soul, not the mother's life. Infant survival was rare. Maternal death was common. Surgery was not hopeful. It was grim. Yet people still practiced it, because sometimes rarely it worked. Some survived amputations. Some healed from wounds. Some lived. These rare successes kept surgery alive, kept knowledge passing forward, kept people willing to try again. Every successful surgery became a story, shared, remembered, proof that survival was possible, even in a world filled with pain. Surgery on the battlefield was even worse. War created wounds that ordinary life never did. Deep cuts, crushed bones, arrows lodged in flesh. Surgeons followed armies, not as healers, but as damage control. They worked in tents, barns, ruined buildings, sometimes directly on the ground. There was no time, no careful examination, only speed. Arrows were pulled out quickly, if they could be pulled out at all. If the arrowhead broke inside the body, death was likely. Wounds were cauterized with hot iron. The smell of burning flesh filled the air. It was believed fire sealed wounds, stopped bleeding, killed corruption. Sometimes it helped. Often it made things worse. Soldiers feared infection more than pain. They knew pain passed. Rot did not. If a wound began to smell sweet or foul, it was a bad sign. Blackened flesh meant death was coming. Surgeons amputated without hesitation. A damaged limb was a sentence. Better to lose an arm than a life. Even then, survival was uncertain. After surgery, recovery was brutal. There were no antibiotics, no pain management, no real aftercare. Wounds were wrapped in cloth, changed rarely. Flies gathered, maggots appeared. Sometimes this accidentally helped. Maggots ate dead tissue, prevented rot. But medieval people did not know why. They feared it. They prayed. Post-surgical infection was common. Fevers followed. Delirium, weakness. Many died days after surviving the operation itself. Families watched helplessly. Survival depended on luck. Strong bodies healed better. Young people survived more often. The weak rarely did. Surgery was never routine. Every operation was a gamble. People remembered surgeons who saved lives. They also remembered those who killed. Reputation mattered. A skilled surgeon could gain respect. An unskilled one was feared. Still, surgeons lived on the edge of suspicion. If a patient died, blame followed. Sometimes violence followed. Surgeons could be punished, even attacked. Failure was dangerous. Over time, knowledge slowly grew. Some surgeons began to understand patterns. Certain wounds healed better when cleaned. Wine reduced rot. Honey helped wounds close. Bandaging mattered. Observation replaced superstition slowly, very slowly. Some monasteries preserved knowledge, copied texts, recorded procedures, mistakes too. Each generation learned slightly more. But progress was fragile. Wars destroyed libraries. Plagues killed surgeons. Knowledge vanished and had to be rediscovered. Surgery advanced in fragments, not leaps. Patients continued to fear it, rightfully. Most preferred prayer first, herbs second, surgery last. It was a door you only opened when death stood behind you. The emotional toll was heavy. Surgeons hardened themselves. They had to. They listened to screams daily. They saw suffering constantly. Compassion existed, but distance protected them. Without it, they could not continue. By modern standards, medieval surgery seems cruel, but in its time it was courage. It was people acting without certainty, without understanding, trying anyway, trying to save life with what little they had. Every scar told a story, of pain survived, of death avoided, of luck, of endurance, surgery. 1,000 years ago was not science. It was survival under pressure. It was human hands fighting death with knives and faith. And sometimes, against all odds, it worked.